It's important to follow a process because you have to have a standard, and without a standard there can be no improvement. And so what we do is we use a combination of A3 thinking, Lean, and Six Sigma, and have developed a process through use of the value realization framework to be able to measure clinical outcomes, financial outcomes, as well as customer satisfaction, clinician satisfaction, learning and growth, and process improvement outcomes within our healthcare organization so that we can improve in a measurable way. I think if you don't have process, you're kind of just left to guessing and making it up on your own, and then it's also not repeatable as you build it out within your organization. I think the big thing with process is that once you have a process, you can improve upon the process. But what I commonly find is that people can't articulate the process that they're following, and it's sort of subjective from one clinician to the next in terms of what they do. And so they're kind of like all over the map in terms of trying to hit the target and get the outcome for the patient. And that's not necessarily a bad thing if you're delivering that outcome, but it makes it tough to repeat. And so what I've found is through repetition, it builds accuracy and builds decreased time. So it all begins with a process and all begins with a standard to begin with. We have an established standard within our organization, and so we use our combination of A3 thinking, Lean, and Six Sigma, and we follow an A3 problem solving. So what we'll do is we use process to identify a specific condition, as an example, mental health, and we'll focus in on depression and or PTSD. And then what we do with that process is we reach out to the clinical experts and leads within the organization, and we sit down with them and we walk them through the process of defining what is the actual outcome for a patient with PTSD that we're trying to achieve. As an example, are we trying to get them and measure whether or not they are working? Are we trying to look at physical functioning or emotional functioning? What is it we're trying to say is the defined success for a patient with PTSD? And we let the clinical experts and the mental health experts help define that as we walk them through this process. So after we've defined the outcome, then we actually take the process and we use value stream mapping, a little bit of Lean, and we go out and map the process from the start of care to the end of care to figure out what is happening. So we interview all stakeholders. This is where we do the time-driven activity-based costing. We measure by minute what each step of the process looks like. And then we do the associated cost value on it so we can get at capacity utilization within the organization. The next step we do is we go and we collect all the data and we determine, okay, who within our clinical staff is achieving the desired outcomes? Who's in that top 5%? And then we go out and we interview them and we figure out why. What are they doing as part of their best practices or use of health IT to achieve that desired outcome? And doing that, we're able to grow as a learning organization and disseminate that information across the rest of the VA.